Good morning, folks. Welcome. It's great to have you all here. Got a couple of questions that I know are burning in people's minds, and we'll answer some questions from the audience. So Meredith, I'll start with you. So what do you consider is really the biggest single challenge that the pharmaceutical industry faces that you think digital technology can help with?
Yeah, I mean, I think the answer varies depending on where in the organization you're talking about. Certainly on the marketing front, digital is just heralding in this entirely new era away from the one-way communication toward more of a dialogue and more of a service-oriented culture. And then also just going from a mass market, mass communication approach toward being able to really get a lot of efficiencies with some very customized and targeted approaches through digital, of course. Then on the sales side, certainly we're seeing that just because of it's not just technology that's changed in the past 10 years. Physicians' lives, we're hearing loud and clear from them, are very different. They're really being bogged down with a lot of paperwork and other headaches and being kind of taken away from patient care. So in many ways, this traditional sales model is just completely at odds with the busy workday of today's physician, and digital is very well positioned to help with that. Also, I think that the Salesforce concept came into being at a time when pharma really had a monopoly on that information, and now, of course, information's been quite democratized. And we're seeing that physicians' needs have changed. It's really more about patient care, getting efficiencies during the days, and technology is very well positioned to help, especially from pharma, to help physicians with some of those things. I think the challenge that we're seeing across a lot of organizations is there's all of these huge changes that have to happen because of these technologies across all of the silos, from R&D, the med info, sales, marketing, but they're just not kind of equipped to be implementing some of these struggles, and it's sort of a struggle to adapt to the world we live in. So that's what's been so exciting about working with POZEN, is kind of working with a company that's able to ask, okay, so how would we design the model across all of these different silos to adapt to the world that we live in today. And it's been really exciting to think about that and also come up with actions that would help put that into place.
Yes, definitely. So Bonin, you're outside the industry, right? You've been working in customer engagement for a long time. So what do you think the lessons are that we can learn from the consumer packaged goods industry?
Of course. First, thank you for having me on the panel. I think that probably the biggest lessons that CPGs have learned or are in the process of learning is, how do you listen to your consumers in totally new ways, and most importantly, how do you respond to that in real time? So how do you take what you're hearing and actually put that into action? And so some of the projects that I've worked on, like some of the work we've done on Gatorade with their Mission Control Center, which is simply a glass room in the center of the Gatorade marketing floor that has monitors very much like NASA Mission Control, but with real-time data visualizations of consumer conversation. But what it's done is it's transformed the marketer's thinking, because it sits in the middle of the brand floor, and the moment you drop a piece of packaging or creative or advertisement, you name it, into the consumer ecosystem, you can see immediate response back. So whether it's a consumer posting it on their Facebook or tweeting about it or being picked up. So what it's done is it's created the mindset where now it's not just good enough to set it and forget it. So the set it and forget it mentality no longer exists. It's more important to put it out into the marketplace and then be able to respond and hear that feedback. So I think that deep customer listening on top of real-time engagement is probably the best thing from the outside.
So Daniel, of course, it's still about the doctor, and we're still in the pharmaceutical business, and we still need healthcare providers to write prescriptions to grow our businesses. That part hasn't changed. But how can we in pharmaceuticals really use digital technologies to build better relationships with physicians?
So first off, let me echo what Bonin said, and thank you and the POZEN folks the opportunity to come and speak with everyone today. It really is an honor and a privilege. I think to answer your question, the industry is at a little bit of a crossroads, as I see it. For a long time, there was an opportunity to be able to use sophisticated sales and marketing to either overcome or to amplify messages that weren't intrinsic in the science or the efficacy. I think that what social media is emerging is that if you've got a good message, if you've got something that's got an intrinsic value that resonates with your audience, you can use these new mediums to very, very cost effectively create a channel of communication on the audience's terms, both in terms of convenience, in other words, when they want it, how they want it, but also in terms of context. In other words, you don't have to set the agenda. Your audience will be able to set the agenda for you, making it all the more relevant.
And I think the cost-effective point is really important, as we're finding, because that allows us to provide affordable medicine. So I think that's an important piece for everyone as they're looking how the model is changing, is that it can actually be much less expensive and more cost-effective. So that's definitely helpful. So Raj, from your perspective, what do you think are some of the most important tools engaging consumers?
Yeah, I mean, I think right now, I mean, one thing is certain is that we're living in a completely multi-platform world. This wasn't the case if you look back 2 years ago. You really didn't have this explosion of smart devices connected to fast networks. And those two trends is what's really driving a pretty amazing environment for media companies, for marketing companies, because it allows us to touch the consumer in deeper ways across many different channels. You know, even if you look back of June last year, web traffic driven from mobile devices was about 7% of overall web traffic. That's already up to almost about 20%. Just, you know, if you look at the data now. So it's pretty exciting when you start to look at how consumers are changing the way that they see media as they start to really get comfortable with these devices in many different environments, whether it's lean back, lean forward, on the go, kinds of content experiences. So I think from a consumer trend standpoint, that's something that we're watching very closely, and I think needs to be part of the way that marketers think about their plans going forward.
And Marc, from your perspective, what are some of the types of content that you think have been the most effective?
Yeah, I mean, you know, again, Raj is describing this world where you have multiple channels to be able to, you still have to have great content. You have to have content that's going to resonate with the consumer. You have to have content that they're going to find actionable and useful in their lives, particularly when it comes to healthcare. One can look at a number of different video channels, for instance, that have been put together by different pharma companies from a corporate level and from a brand level. And the content that lives there is dry. It's not necessarily engaging. It's not necessarily the sort of content that you want to watch or share with others. The opportunity here is to create content that becomes something that people can take in, can understand and actually be able to use, but also can start a conversation with a physician or start a conversation with others who are struggling with the same disease. Because at the end of the day, what you want to be able to create is content that means something to the consumer that they can use in their daily lives and ultimately could potentially improve health outcomes.
Yeah, and that's really what it's all about.
If I could jump in on that, I think the other thing that's been so impressive about digital, it's not just about market sizing. What is the biggest thing that people are using? But we're seeing, as you look across different segmentation strategies, different things engage different people. And so you can now do all of these different things. Video might be what works for this audience, and social might be a great place for them. You know, some physicians learn by more lean back versus kind of pull and interactive. So it really allows for all those different learning styles.
You know, and I think about what Bonin was describing in terms of the listening that was being done around Gatorade and some of the other major brands from the CPG side. To be able to create that content, we really have to understand that audience. And that first starts with really listening to what those conversations entail, what topics are going to resonate, and what sort of content the patients are actually looking for.
But the one thing I would also say is I think content creation is a totally different concept now. So, you know, is it long form content? Is a tweet a piece of content? So when we look even on the Gatorade side, we would have people from the Sports Science Institute come in, scientists come in and talk to athletes about training, and they could be simple responses, but that response gets retweeted. So now that becomes a piece of content that becomes part of a library. When we see similar questions or conversations from consumer, or in this case, athletes, we would drop those comments back in. So now we have a content library that looks, you know, totally different than I think most people would think of content. It doesn't necessarily just mean video and you know, and written posts and stuff. So.
So Meredith, kind of looking forward, right? You guys are all about the trends. What do you see are some technologies that you think are going to be driving?
Sure. I mean, I think obviously mobile is completely changing the game, both in terms of, you know, on the consumer side with what the opportunities are for engaging consumers down to either a localized or even just that individual, much more engaging types of content. Again, really getting away from that kind of printed handout. physicians, I think that the mobile is having a huge impact on just how they gather information during the workday and how they learn to practice medicine today, as well as the engagement opportunities. Obviously, social media is changing the whole game with how consumers and physicians are engaging. But what I think we're starting to focus on also is understanding beyond the platform, because certainly those are all the platform adoption metrics, et cetera, are changing kind of under our feet as we measure them and talk about them. But how it changes sort of the core of how people understand their world and interact with it. So how does it change how physicians learn and gather information? How does it change service expectations or engagement expectations? So even thinking beyond the platform, since that changes so quickly, what's the overall kind of big picture macro changes we're seeing in audience expectations, if you will? So those are some of the things we're looking at.
That's great.
If I was just going to say, I also think on the emerging technology side, what fascinates me is I think this explosion of connected healthcare, and I really think that connected healthcare will probably be one of the biggest things that our society will see from kind of technology. And by that I mean the ability, whether it's the emerging stuff you're seeing now, the Fitbits, the body media, or Basis Health, where I'm able to track every single thing about myself, or connected blood pressure cuffs, but that idea of the quantified self, and when now I can see myself in numbers and I can actually see my progression through my own healthcare, means that I have a closer connection to managing my own health. It means that physicians need to think different, pharma companies need to think different, and then that combined with social aspects where my friends can also see, is my blood pressure going down? What kind of impact are those going to have? So I think that's an exciting space with emerging technology too.
And I think that creates a great opportunity for dialogue between the professional and for the patient to actually work on those figures, those numbers that are being collected to create better outcomes ultimately. Dan?
It's interesting. You take the common thread between what the three of you just said, and it is really where you're seeing some of the greatest interest. In that in the past, if you look at like the last 5 or 6 revolutions, whether it was print to radio to TV and web, the producer of the content, the advertiser, could to a large degree control both the content and the broadcast, the medium. They could a brand.com or a portal or a web page. What's so interesting about what's happening right now is that it's as much about the syndication and the sharing as it is the content itself. And to some degree, you're starting to see the tail wag the dog, which is what I'm starting to hear Bonin talk about, which is people are generating content in such a way that it'll be well received and ultimately get the ultimate kudos or credibility in this world, which is syndication. That's all these things are massive syndication mechanisms, whether it's Facebook, Twitter, or LinkedIn. They're simply lubricants in the syndication process. And I'm seeing, it's very interesting that the industry is now starting to recognize that the goal is syndication, and if everyone recognizes that, then it starts to influence the types of content and the manner in which you produce it.